haven't heard anybody in my party saying that illegal immigrants should get access to the health insurance marketplace.
Raise your hand if your government plan would provide coverage for undocumented immigrants.
Okay. Also cover illegal immigrants.
Sure. So, yes, I'm never going to be in favor of a policy that denies people access to public health, public safety, or public education based on their immigrant status.
That all people in this country have the right to health care.
Would you include the 11 million undocumented immigrants?
Absolutely, absolutely.
His first order of business, expanding state-run health care, including full coverage to 138,000 illegal immigrants.
So you support giving universal health care, Medicare for all, to people who are in this country illegally?
Let me just be very clear about this. I am opposed to any policy that would deny in our country any human being from access to public safety, public education, or public health, period.
You said they would be covered under your plan, which is
state lawmakers passed a bill that would offer Medicaid to undocumented seniors. Do you expect to sign this, and do you foresee expanding it just beyond seniors?
I will sign that bill. I think it's important.
I did universal health care when I was mayor, fully implemented, regardless of pre-existing condition, ability to pay, and regardless of your immigration status. San Francisco is the only universal health care plan for all undocumented residents in America. I'm very proud of that.
On undocumented health care, which I, again, think it's a human right. I think it makes economic sense.
We want to save health care for all people. Thank you.
When we talk about Medicare for all, A-L-L, it means all. It means every man, woman, and child in this country, including the undocumented.
Everybody is in and nobody's out in my bill. Now, I don't want it to be an immigration bill. I want it to be a health care bill.
Would they have access to health insurance?
Yes. Health insurance for undocumented immigrants is a deal breaker for you.
That is one of the pillars of the plan as I see it.
Health care is a human right for all, including, by the way, the undocumented in this country.
Accusations tonight against an Illinois program that provides health care for undocumented migrants.
People need to get health care. I am in favor of universal health care. However that comes together.
Will this plan also include undocumented people?
And the answer is absolutely, of course.
You, as several of your fellow competitors for the Democratic nomination, support government-funded health care for undocumented immigrants.
This is not a progressive decision. It's a common sense thing.
Undocumented people should have the opportunity to buy into the plan.
The proposal for Medicare for all that I introduced includes making sure that undocumented people are also covered.
You should be able to buy into it, in my view.
Should undocumented immigrants also be able to get subsidized health care?
They should have access to health care. They should have access to what everybody else has access to.
Para mí es ofrecernos una oportunidad para la seguridad de salud a todos en nuestro país.
To once again lead on health care and provide a pathway and a framework for 1.1 million undocumented residents in the state of California to avail themselves to high-quality, comprehensive medical care.
Well, is that the same thing with you? Do you believe people come here who are not citizens? They should all be getting food, health care, housing?
Depending on which law you're referring to, in certain circumstances, we do provide these services.
Supportive of a Medicare for all single-payer system. And that means that everybody in the country has health care, including the undocumented.
Medicare for all, as I put this together, covers everyone, regardless of immigration status. And that's it.
We have universal health care regardless of immigration status that we expanded last year up to the age of 26. And clearly, as you know from my budget, we had a desire to do even more.
If it's okay, Judy, and deal with the homeless and the, not homeless, undocumented, pardon me, but nobody gets turned away in this state.
Over the age of 65, we'll pick up that tab regardless of your status. So we're going to take care of them as well. So I believe in this.
And we do ourselves no favors by having 11 million undocumented people in our country be unable to access health care.
I have a different bill called the HEAL Act that is specifically around health care for undocumented folks.
I think that anyone who is in a situation where they're in
of health care, regardless of whether they're documented or undocumented.
Would you consider including the 11 million undocumented immigrants?
Once we're in balance, I think that would be the next step.